Solomon, and I complete my practicum in Fraser Health Authority with a population and public health. Specifically the tobacco working group, and one of the main things I was working on was smoke-free policy. And today I just going to present my product that I was working on, which was on creating resources for staff to help them implement and support smoke-free policy in Fraser Health. Just a little background on tobacco use. It is the leading preventable cause of death and disability. It's a major risk factor for cancer, cardiovascular disease, respiratory disease. And in BC, there's about 13.2% people identify as smoking. Secondhand smoke has also been shown to be equally detrimental. So smoke-free policies are very useful because they help protect from secondhand smoke. They reduce the opportunities for people to be tempted to smoke, both old and new smokers. And it helps create that positive environment for tobacco cessation interventions. So many health authorities have implemented smoke-free policy. There is variance in coverage. Some places have complete smoking bans. However, other places have some exemptions for certain populations like mental health or residential. And other places have designated smoking zones. And we also see variance in the types of tobaccos that are covered by smoke-free policies. Some places don't cover e-cigarettes or medical marijuana. In Fraser Health, they adopted smoke-free policy in 2008. It was revised in 2014 to include e-cigarettes and medical marijuana. And previous exemptions to residential mental health facilities and patients were removed. So this was where I was in. So just a little bit background on smoking bans in health care sites. So smoking bans are really useful because it can reach a large number of smokers. We see a lot of smokers are readmitted. And because of their conditions, they're very receptive to smoking interventions. And smoke-free policies are seen along with tobacco cessation as mutually enabling factors. So they work hand in hand to support each other. So we do have some barriers for implementing smoke-free policy. There's persistent challenge. There's a view of whether smoking is addiction or is a bad habit. If it's addiction, there's more likely to get medical interventions. There's also inconsistent practice. Even on the same units we go to, from our surveys, we find that some staff do offer clinical smoking cessation, or they're more involved in smoking policy, whereas other staff who don't see as important, they're not as involved. And two other things staff has identified was that they haven't received sufficient training, or they're not aware of the current policy. And also roles has been another big factor that was identified. A lot of the staff think it's the security's job to go and approach smokers on site. And two other factors are issues of enforcement and the lack of support they feel from leadership. So as a result, many health facilities, what we've seen is they've been slowly reverting back to old practices. So similarly, our own results survey done in Fraser Health has shown similar. So this survey was done, the Fraser Health Smoking Cessation Resource and Practice Survey was conducted by another MPH student, Kasra Hassani, during my time there. And one of the questions he asked was, what's the biggest barrier for clinical staff to help patients stop smoking? And 37% said, I respect their choice whether they smoke or not. I don't have the time to approach the patients, 24%. I don't have the knowledge skills to approach a patient, 20%. I don't see it as my role, 19%, and I don't see it as a priority, 15%. So there are some identifiable gaps that we've identified. And so back to our tobacco working group, so we're thinking of what kind of resources we could create to help support the smoke-free and support the staff in general. And we've traditionally, most of the work has been focused on clinical staff. So a lot of the training, education, they've gone to the clinical staff. So we're, however, approaching non-clinical stakeholders, we found that they've been also very motivated and very interested in being involved in helping, especially in areas of smoke-free policy. So we were thinking, brainstorm, can we find some roles for staff? And our question that we came with is, can we create these resources to support both clinical and non-clinical staff to engage and communicate with smokers? So any resource we develop is not just going to be a training resource, but it's also something to raise awareness on the current smoking policy. And it's going to encourage staff to participate, and hopefully over time we want to have that promotion of that smoke-free environment in the healthcare setting. So we're looking at approaches to incorporate that can also include non-clinical staff. And from the literature that was searched, there was two main approaches. There are pharmacotherapies that include nicotine replacement therapy and behavioral interventions such as motivational interviewing, brief advice counseling. So some of the challenges is the pharmacotherapies in the healthcare are restricted to clinical staff. So because of the chronic conditions, there has to be some knowledge of drug interactions, dosage, side effects, and most of the medications are restricted, so they're not accessible. So the other area, behavioral interventions, most of the research has been done using clinical staff. So we're not sure of its effectiveness with non-clinical staff. And a lot of these approaches require clinical expertise, such as reflective listening. Most of them are lengthy conversations and require follow-up sessions. So it was something that did not fit with something for non-clinical staff where the interaction might be brief. However, in our literature search, we did find a brief advice intervention that offers some potential. And just a quick overview of brief advice intervention. It's basically the 5 A's: ask, advise, assess, assist, and arrange. Even when only components are used, they're still effective. They're good for under 5-minute engagements, and they're very easy to train the staff there. So we create this how to talk to smoker resource that we're going to be distributing soon. So it's based, it includes the current policy, so it updates the staff. It has that promotion of we want to have a smoke-free environment because we want to create a healthy environment. And as a lot of our engagement with the people who smoke on site, they've stated that they felt there were staff who came and approached them were very confrontational. So just a brief overview of being very positive and respectful attitude while providing the advice and assistance. And finally, it is okay to walk away from individuals who don't comply. You don't have to stand there and wait for them to stamp out their smoke. And this is the pamphlet that I developed with the Tobacco Working Group. So again, it includes all the components that we talked about. And it has a couple of sample phrases that staff can use. I'm sorry, you can't see it. But engagement starters and some resources that staff can refer the person who smokes on site. And this approach is not only just for the resources to train staff, but it's also for something that they could use to engage and help enforce the policy. So this is a business card that we've also developed. And again, it has similar messaging on the importance of smoke-free environment in a healthcare setting to keep patients, staff, community healthy, and some resources they can use. And finally, some of the other things the Tobacco Working Team was working on was communication tools for the leadership, specifically site leadership. So this is a spectrum of intervention. So basically it lists a bunch of actions site leaders can use to implement to help them support smoke-free policy. And they're based into actually 5 columns here. There's education, encouragement, engineering, enforcement, and evaluation. And it's just some additional resource for site leaders to take advantage of. So what are the benefits for Fraser Health? Of course, getting the non-clinical staff involved, it creates additional capacity. Creating this resource shows some organizational commitment to help make this a priority. And we want to create that participant accountability. And over time, we want to create that smoke environment and that shift in perception. So just want to acknowledge the Fraser Health Authority, specifically Tobacco Working Group, and my supervisors, Judy Messenden and Dr. Helena Swinkles, and the 2 helpers, Ruth and Kazra Hassani, for their help. And thank you, that's my presentation. Any questions?
Thank you for your presentation and for all of the information that you gave us. I'm wondering if you've had any consultation or expect any pushback from any of the unions of the employees of the Health Authority or WorkSafe BC asking them to take this role?
We haven't engaged unions per se, but we have done focus groups with staff on site, and there was already some pushback. So that's one of the things that we have to be ongoing discussion. But in the past, what happened in 2008 was they did a media presentation, smoke-free policy, they did some training, they sent a couple emails, and then they just left it at that, and it sort of fell flat on its face. So this time they're trying to do a more comprehensive approach. So on the upper levels, you do see, especially the tobacco working group, they are engaging various stakeholders. So they're going up to the leadership groups, they're going to other groups like security, facilities, plant management, just to make sure everyone is playing a role and being involved in this.
Thanks, Solomon. That was an excellent presentation, and you're standing up for the rights of non-smokers. Thank you. I'm just wondering, because you might have the inside scoop, what about, is anybody looking into the third-hand smoke situation? You know, when you have a coworker or somebody comes in and sits across from you in the next cubicle and they've been smoking and you have to smell that smoke, it's just horrible. And you know those particles are floating around. Is anybody working on that issue at all?
Not specifically, but we are aware of it. Like, as I mentioned, the other MPH student did send a survey out across Fraser Health, and we got about 1,000 responses from staff alone. So some of the comments did state, you know, when they go into elevator, they can smell the smoke off the person, and it's one of the issues. But we also have to work through different sites, because when we consider the whole health authority, we have some sites that are owned by Fraser Health and some aren't, so third party, and then we have to work with those different partners, site property management and all that, yeah.
Any other questions?
Down there?
Oh.
Solomon, I noticed that with Fraser Health, they've also got a ban on the e-cigarettes.
Yes.
Do you know if there are other health authorities in BC that have the same? We've recently had a ban in Island Health, and I don't know if it's transcends over to e-health or to e-cigarettes.
I'm not sure about Island Health, but we have had some discussions with Vancouver Coastal Health too. So I think they are leaning that way as well. Yeah, and again, we're waiting for the provincial tobacco strategy that was released. So, and I think it's going to still in the second read. So it's going to be a while before it's implemented. Yeah.
Okay. Thank you, Solomon.
All right.